This is a treatment for shin splints. Now in my article, if you read it, we talk about shin splints and how the shin, if divided up into three parts, proximal, medial, and distal, we're dealing with the distal 1/3 of the tibia, and it's usually about right here where shin splints hurt the most. Now sometimes they're a little higher, but mostly it's here. And if we think of the tibia as a blade, we go behind the blade and dig your finger deep into the tissue there, you'll find a lump. Now the lump is easiest discovered if you put a little gel on there and slide your fingers along, and you'll feel a definite discernible lump. And if you feel that, that's the area where the person's going to be most sore. And you can do this on yourself. Now, if the tenderness is on the bone itself and it's really swollen there, then you know that you probably have a tibial stress reaction, and that reaction means that the tibia has probably had damage to the exterior of it, and the periosteum, the material around the outside of the bone, is really irritated, probably indicating that you're on the road to getting a stress fracture. When I do this, it's called instrument-assisted soft tissue manipulation, and we use a stone called a Gua Sha stone. This one's made out of jade. We're going to take this gel and put it on here and just glide it along the tissues, and you'll feel a discernible lump, which becomes really obvious when you cross it. And you just work that lump and work it and work it and work it and smooth it out. Get all the knots out of the muscles. This is breaking up adhesions and fibrotic adhesive tissue, and breaks it down, softens it, lines up all the fibers of the tendon so that they start integrating normally into the muscle and restores the function. This is a really simple technique. Go down behind the blade of the bone and work it this way. You can also turn the stone on one of the ears here and work it back and forth. Okay, now that you've seen me do it, watch this. We can have the patient or the runner do it themselves. Just grab the stone and have at it. And you know, you might not be good at this at first, but give it a try. Practice a couple of times. You'll feel a lump, a sore spot, work the sore spot, get the lumps out, and once the lump's gone, you're gonna feel better. This hurts like the dickens, by the way, but when you're all done, it'll help speed things along if you have shin splints.